We are back here on the Lynne Hayes Freeland Show. We're talking about the violence, this surge almost in violence that we're seeing on the street. And Richard, I want to just finish one thought before we move on, because you and I talked earlier. We talked about this thing that happened on the South Side last week, and people were saying he's a 15-year-old. Where were his parents? Well, parenting today doesn't look like a lot of people think it does.
Right, right. So we have younger parents again. I know we always talk over the years about how young the parents are. You know, we got grandparents that are 35 years old.
Wow.
So all these kids was fighting to get out of the house, right, at an early age because of the different things that they were into.
Mm-hmm.
But also think about when I say a grandmother being 35 years old, you know, that some of these parents, they still clubbing. Drugs and alcohol is at the foundation of our problem. I'm never going to give up on that. Drugs and alcohol. You know, when we talk about how now, you know, if you driving behind a car, you know, weed is legalized. Everybody's talking about, I got my weed card. I can tell you the reentry program that I'm doing called Reimagine Reentry. One of the first things that I had to deal with is guys saying, well, I got my weed card. I'm like, but you can't get a construction job smoking weed. When they drug test you out. You have to stop you have to stop this.
You gotta be clean, yeah.
The normalcy of, you know, smoking weed, taking pills, you know, I think that a lot of times that many young people that are involved in violence, they're high. They don't realize what they're doing. But then when they sit in the penitentiary for the rest of their life, you know, because of something stupid that they did, they pulled the trigger, right? They have no emotions. When you look at some of these kids, they are emotionless. You know, no emotions. That's the issue. That's the problem.
Now, speaking of this emotion thing, and you and I talked about so many things before we started. It's just like I want to try to get it all in. One of the things that you do now in your new role as assistant professor of public health practice is you go to hospitals, you go to emergency rooms, you see these gunshot victims. You are there in that moment that in many cases, their lives have changed forever. What's that moment like? What's that?
It's hard for me to see a young person where he's going to be a paraplegic for the rest of his life. He's not going to be able to walk.
And he's 16, 17.
And he's 16 or 17 years old, you know, and he hasn't come to grips with that he's never going to walk again, you know. And then the other thing that we talked about is most of the times, young person, 17 years old, the mom don't have the money to build a pathway so that wheelchair can go, wheelchair accessibility for them to go up and down in. So that's another burden, you know. I'm always talking about single parent families and many of the young men that I see that have been killed, you know, the dad isn't around, or the dad might be in the penitentiary, or the dad's dead, or we don't know. You know, this drugs and alcohol has really hurt our community.
All right, now I'm going to ask you this. I'm going to ask you the same question that I asked you earlier, though. When you see that young man in the wheelchair, that young man comes back to the community, a community, whether it's the same one or a new one. Why doesn't that then resonate in the community? Have people say, well, wait a minute, whoa, this can happen. This is real. I need to get my life together.
But everybody says it ain't going to happen to me. It's not going to happen to me. You know, I can only go on how I thought when I was young. You know, I thought that nobody in the world could beat me or do anything to me. And the lifestyle that I was living then, you know, all my friends were dying around me. You know, all my friends died when I was in the penitentiary. I got a roadie, who I just talked to today. He's been down 53 years. He's one of the oldest juvenile lifers in Pennsylvania right
Wow.
now. Trying to get him out. His name is Stephen Northington. I used to have people I'm hoping people write letters about him. It's time to let him out.
55 years. 55 years.
53.
53. All right, we got a minute left, Richard. What's our takeaway here? I mean, where do we even start?
You know what? We have to start with the community, families, moms, dad. We got to get more involved in our kids' lives. Education is important.
Mm-hmm.
Education is the thing that saved me. But I want this whole thing of the community coming together. When we say it's a village, it takes a village to raise a child, it's true. We have to get back to the village mentality. You have to reach out to your neighbors that's new to the neighborhood. Like the neighborhood that I live in, when I used to live in the first.
You got to know your neighbors. You got to know your neighbors. Yeah.
Kids was the ones that came in, knocked on my door and introduced themselves.
Right. Exactly. Yeah. But that doesn't happen today.
Get back to that.
Hey, Richard, we are out of time. We got to do this again, though. Let's try to get together in September. School's starting back. A lot of things going on. You'll come back on?
Absolutely.
All right. Thank you, my friend. Thank you. We'll take a commercial break. When we come back, some medical news you don't want to miss. Stick around.